is very easy and very common for people to make Social Security and Medicare mistakes at 65. In this video, I'll be asking you 5 questions about your specific situation so that you will be able to avoid making those common mistakes. Now, mistake number 1 that we see people make is taking their Social Security benefits too early. And so the question we have to ask to see if we should be taking now at 65 or at a later date would be this primary one here. Are you planning on working past 65? And so let's say you say, yes, I plan to keep working after 65. There's really 2 things that you have to know about then. Number 1, are you aware of what your full retirement age is? Because if we go to full retirement age, we will not be subject to any earnings tests, nor are we going to have to take a reduced benefit. So if you're going to keep working, you may really not need your Social Security money now. It may be best to wait. And so the question is, do you know your full retirement age? So let's say someone is turning 65 today. That means they were born 9/14/1958. Their full retirement age is 66 and 8 months, which would be what? They would turn 5/1/2025. They would actually hit their full retirement age. So if they decide, yes, I'm going to keep working now, we can only make so much money. And again, that is called the earnings test. And so the way the earnings test is this. They're going to test earnings, which means working wages. They are not going to test investment income, rental income, distributions from 401ks, IRAs, pensions, annuities. Not going to test any of that, only working wages and just yours. And so we can only make so much money. So here's what happens in this scenario. Someone turning, let's say 65 today. This person was eligible for Social Security at 62. And that would have been what? That would have been 9/1/2020. They could have started drawing their Social Security benefits. It certainly would have been less, but they're also subject to the earnings test from 9/1/2020 all the way up until December of 2024. They're subject to the lowest amount of earnings test, which right now is $21,240. And so if our income or working wage is above $21,240, they're above that. For every $2 above that, they take $1 out of your Social Security benefit. Now, that earnings test changes the year we turn full retirement age. So again, we're turning May 1 of 2025. So what happens? 1/1 of 2025 through April of 2025, the earnings test goes up drastically. Again, this is the year you're turning. Not yet hit the month I'm turning, but the year I'm turning. Now I can make $56,520, and for every $3 above I make, they take $1 out. So I can make substantially more the year I turn, and the penalty is going to be less as well. And so, but here's what happens. Once I hit my full retirement age, and that would be 5/1/2025, the earnings test goes away. So sometimes people are above those earnings limits and they take their Social Security and they don't get a check until maybe July or November or whatever. But the point is they're delaying those Social Security checks until you have actually paid back that penalty amount. So again, we don't want you to take Social Security too early. So if you're going to keep working, if we're going to be below these earnings tests, it may be fine to do so. But if you're going to be above it, you may want to think that through. All right, now the second answer could be, as we say, are you planning to work past 65? And you say no. And then we would say this, are you fine with what? A reduced benefit. Because at full retirement age, we're going to get that full amount. But for every month that we take early, we are going to lose 0.5%. Okay, 0.5%, which is basically 6% a year. So if I take 1 year early, I'm going to lose 6%. And so in my scenario, if we took today, 9/14/2023, with a birth date of this, we actually would lose 10%. And so if your full retirement age benefit is $2,000 and you take early, you're going to lose that 10%. Your check's going to be $1,800. And that penalty is going to be a reduction for the rest of your life. The only way your Social Security benefit then would change is if we have cost of living adjustments. Okay, so that is mistake number 1, taking too early. And it's fine if you want to take, you just have to be comfortable with the reduced benefit, or if you're going to keep working, you got to be sure you stay below the earnings test or you'll be penalized. Now that brings us to the second mistake, and that is enrolling into A and B at the wrong time. Some people enroll too early and some people enroll in late. And so the question is, do we need to take Medicare at 65? And the answer is yes, if you're in one of 5 scenarios. You must take Medicare at 65 if you are covered right now by a health insurance plan that's part of a retirement plan. That health insurance retirement plan could be part of your spouse's plan, or it could be your plan. Either way, if I'm covered by retirement insurance, I have to go on Medicare at 65 because the retirement plan will only pay second to Medicare. It'll no longer pay first as it does getting you to 65. So you're required to. So yes, you do. Now, secondly, if you're on COBRA insurance, and the answer is yes as well. If you're covered by COBRA, you may want to keep that COBRA a little bit, especially if it's paid for by the company. Don't keep it too long, and you'll see why here in just a few minutes. But if I keep the COBRA, that's fine. But once I'm Medicare eligible, COBRA will no longer pay first. It pays first to get you to 65, but after that, it only pays second. So if you don't enroll in a Medicare and you're on COBRA, you're the first payer. So you've got to enroll to put Medicare in the first payer position. Thirdly, if you're on an Affordable Care Act plan, you went through the Healthcare Exchange, the healthcare.gov plan to get that plan, whether it's individual or family, again, you are going to start Medicare at 65. And the reason for that, all the benefits of the healthcare plan, that ACA plan, are going to go away. You will pay full premium. You will have no cost sharing. You'll get no tax subsidies. In other words, all the incentives that make the ACA plans attractive are gone at 65. So technically, you can keep the plan, but there's no reason to do so financially. So we're going on Medicare at 65 if we have an ACA plan. Fourthly, if you're covered by a TRICARE insurance, which means you're retired from the military, not served in the military, that's VA, but I mean retired from the military, you have TRICARE. And so what happens, TRICARE pays very well, it's great insurance, it gets you to 65, and then they change payer positions. TRICARE says you must enroll in A and B, enroll in A and B in the first payer position, and then TRICARE is going to pay second to Medicare. So again, you got to take Medicare at 65 if you're retired military. And then lastly, if you are still working or your spouse is working and you're covered by some kind of a group employer plan. If there are at your company or spouse's company 19 employees or less, you have to enroll in a Medicare A and B. That's considered a small group, and once you're 65, that small group plan only pays second. And so if you don't enroll in a Medicare, you become the first payer. So again, you have to enroll in A and B, and then that group plan would be second. All right, so the point is this. You do have to take if you're in one of those scenarios. Retiree plan, ACA plan, COBRA, TRICARE for life, or a group of 19 employees or less wherever you or spouse are working. Okay, now, do you need to take Medicare? And the answer here, no, as long as you or your spouse are covered by a group plan. Okay, this means someone is actively working and there are 20 employees in that company. I'm not saying in the group, but 20 employees or more, then you're not required to do anything at all with Medicare. You don't have to take A and you don't have to take B whenever you have a group that's 20 or more. Hey, if you're finding this video to be helpful and you would like to learn more about Medicare, you'll notice up here in the right-hand corner, there's an eye. And if you'll click on that eye, it's going to take you to a 20-minute workshop. I see people make mistakes all the time, and we don't want that to happen to you. And that's why we're giving you free access to this workshop. So go ahead, click the link, and learn more about Medicare. All right, that brings us then to mistake number 3, and that's this one, enrolling into A only at 65. Enrolling into A only at 65. So here's the question, should you take Medicare A only? And the answer could be yes, as long as you do not have a health savings account. So this means, remember we said earlier, this would be anyone that is in a group of 20 or more employees, active employment, you or your spouses. You don't have to do anything with Medicare. You don't have to do anything with A or B whatsoever. But notice here, it's fine to take Medicare only as long as you don't have an HSA. HSA is a health savings account. It's not flexible spending account. It's not health reimbursement arrangements. Those are called HRAs. I'm not talking about that. I'm talking about a true health savings account. That means you're covered by an employer plan that has a high deductible based upon the parameters of HSAs, and you have an HSA that you're contributing to, maybe your employer is or both of you are, and you're putting money into that HSA. And so I would say this, should you take Medicare only? Yes, as long as you don't have an HSA, it is fine to do that. But Now, I would say this, no, if you have an HSA. So if you do have an HSA and you want to continue to contribute money to that, then absolutely do not enroll into Medicare A. And I promise you, as long as your Medicare A premium is 0, which means you have 40 quarters, 10 years worth of work paid into the Medicare tax system, you will not be penalized for Medicare A. You just won't be. So many people enroll into A only because they're told that even if they're going to keep working, they have to take A, and if they don't, they'll be penalized. And that's not true. As long as Medicare A is a 0 premium for you, which is 99% of the population, simply because you have 40 quarters, you're 40, or your spouse is 40, then there's no premium at all, and therefore there's no penalty. So if you have an HSA, I say it's best to continue to contribute to that HSA until you get ready to retire. Now remember this, let's say you're going to work to age 67. You're going to apply for Medicare probably about 3 months before you retire, and you take that Medicare benefits. You're going to apply 3 months before that. When you apply, they actually backdate your A date 6 months. Now, they'll never backdate the A date any sooner than 65, but they'll backdate it 6 months. So if you are going to start Medicare at 67 and you enroll 3 months before, from that month of enrollment, they're going to backdate your A date. And officially, when you have an A date, there should be no new money going into your HSA. So my point is, don't contribute to that too long. Continue to contribute, but do some proper planning so that you're aware of the A date, because then you need to stop your contributions. Okay, so let's go back to it. You don't need to take Medicare at 65, A only, if you have the HSA. Now, if you don't have an HSA, I think it's fine to go ahead and enroll into it. Remember this, though, Medicare is the second payer. Your group plan continues to pay first. Medicare A pays second, which is on the hospital side. They pay no copays, they pay no deductibles, but they will pay co-insurance if you have some responsibility for that. All right, so that's the answer to that question. All right, now let's go to question number 4, mistake number 4. And this is a very, very serious one. They're all important, but this one extremely. And that is missing the Medigap open enrollment period. Now, what this has to do with, folks, the open enrollment period means this. When I start my Medicare A and B, there's this special period called the open enrollment period for Medigap policies that lasts 6 months. 6 months, and that 6 months is attached to the B date. So let's ask this question. Do you have any pre-existing conditions? And so if you tell me yes, you do, then I want to make sure that you do not miss this very important Medigap period, because in 46 of the 50 states, so the 4 states that don't have this issue would be New York, Connecticut, New York, Connecticut, Maine, and Massachusetts, and that's it. All the other states, New York, Connecticut, Maine, Massachusetts, all the other states, if you do not get a Medigap policy during this open enrollment period, then if you ever want to pick one up at a later date and you have serious health issues, pre-existing conditions, that insurance company does not have to issue you a Medigap policy. But during 6 months of your B date, they have to issue a Medigap policy. Why? Because you're in that period of time where there's no underwriting required whatsoever. So let's just say my B date was today. I'm shooting this video September 14th, 2023. But let's say I went on Medicare today. And I have an effective date of 9/1/2023. I actually can apply for a Medigap policy 6 months in advance of my Medicare B date, all right? But what happens is once that period is started, that B date starts, I have 6 months, I'm still in this period of time. So that is all of September, October, November, December, January, February, okay? Which means what? After March 1, in this example, 2024, in 46 of the 50 states and the District of Columbia, if you want to get a Medigap policy now, you have to medically qualify. 30 health questions we have to ask you. We got to check all your meds, get a statement from your doctor. And if that insurance company does not like your pre-existing conditions, they don't like certain meds you're taking, then they can deny that MedSup application, and you may not get one then for the rest of your life. So the point is, don't miss this very important window, 6 months before you start Medicare and then 6 months after, because there's no underwriting whatsoever. So if you say to me, I have some serious pre-existing conditions, could be your one and only opportunity to get a Medigap policy. Now let's say you say no. Okay, then what sometimes happens is people then are tempted, because they are healthy, to go onto a Medicare Advantage plan. Okay, and you'll see here in just a minute there are differences between MedSups and Medicare Advantage plans, but here's the issue as it comes to pre-existing health conditions. Let's say that you're perfectly healthy, you don't even take any medications, and you see the Medicare Advantage plan. Sometimes people are tempted to go on that, and then here's what happens though. What happens if you stay on that Advantage plan for a year, 2 years, 3 years, 4 years, 5 years, whatever, any period of time after 1 year, what happens if you want to get off of the Medicare Advantage plan and then pick up a supplemental plan? Now we have pre-existing issues. Your first 6 months on that B date, you didn't have any pre-existing issues. They have to take you. But if you start with Advantage plan and you stay on that plan any period of time, a year or more, or sometimes even less than that, then what happens to get off the Medicare Advantage, you have to go through underwriting, again, except in those 4 states. And now, if your health has changed while you've been on that plan for 2, 3, 4, 5 years now, that insurance company no longer has to take you. All right? And so you just have to be aware of that. And so again, we don't want you to miss that very important MedSup open enrollment period because there's no underwriting. They have to take your pre-existing conditions. They have to issue that policy. But after that, they don't. And certainly after you've been on an Advantage plan for a period of time, they do not either. Hey, if you come to a place where you know you're going to have to make some Medicare decisions pretty soon, the best way to do that is to click up here in this right-hand corner, and you'll have an opportunity to be able to book a call with one of our Medicare guides. All the guides around here I have personally trained, and they truly are professional. They'll answer your questions, and they'll show you different Medicare options to make sure that you're confident in the decision that you make. Okay, that brings us to our final mistake, and that's this: choosing the wrong Medicare plan. Folks, when you go on Medicare, you really only have 2 options because it is very rare and really, frankly, unwise for people to have A and B only. They always want some kind of additional insurance. And so there's 2 options you have. You can either choose to stay in original Medicare A and B, get a supplemental plan to fill in the gaps. Those are called Medigap policies or Medicare supplemental policies, and they fill in the gaps of things that Medicare paid for, but there was still a balance. The gap's going to cover that financial balance. Okay, or what you can do is you can get what's called a Medicare Advantage plan. In either system, I'm enrolled in Medicare A and B. So to have a supplemental plan, I'm enrolled in A and B. To have an Advantage plan, I'm also enrolled in A and B. But my Medicare Advantage plan is a private health insurance company that actually replaces Medicare. And so in that system, now I have a private health insurance company that is really orchestrating my health care services, directing those, approving those. There's all kinds of issues there. We have a private health insurance company that really is taking care of you. That's why they call those replacement plans. So Medicare Advantage plans, C plans, replacement plans, all synonymous. So those are the 2 systems: A and B with the SUP, or replace A and B with that Advantage plan. All right, so let's talk about this issue here. Here's the question: are you aware of the differences between supplemental plans and Advantage plans? Many times people are not, and so they make a decision not really understanding what they're doing. And so if you say to me, oh yes, I understand the differences between Medicare SUPs and Advantage plans, and you say yes to that, then I would say, what are they? What are they? And again, I'm not trying to in any way be sarcastic, but here's what happens. I know that agents really push Advantage plans because we make more money. We get a substantially higher commission and a longer commission when people take Advantage plans. So agents really want to push them. Some agents, that's all they want to talk about because, again, they're chasing the higher commission. And so most people only understand the differences that the agent wants you to know. So what do they talk about? Normally, they say, oh, we got all kinds of perks. We're going to give you a $1,000 dental allowance. We're going to allow you $100 for vision allowance. We're going to allow you to go to the gym at no cost. And so they have these different perks that are thrown in. And so that's what most people think about. They also know that beyond paying Medicare, those are 0 premium plans. We don't have to pay a premium to the insurance company. But beyond that, almost all the other services that you're going to get besides seeing a primary care doctor, you're not going to pay a premium, but you're going to pay co-pays along the way. And so my point is the difference between these are typically what agents do is just tell you the nice things, the kind of the advantage of the Advantage plan. But they don't talk about the disadvantages. And so that's the question here. What are the differences? Well, here they are, because there's 3 of them that you must know. It's very important to know this. Number 1, every single Advantage plan is going to have a network. And that means it's going to be an HMO plan or it's going to be a PPO plan. Okay? And so you are bound to those providers within the network. Now, the HMO, you can't even go out of network at all. It's not a possibility. They won't pay a penny. Now, the PPO allows you to go out, but when you go out of network, it could cost you $7,000 to $10,000 if you have any kind of a serious illness. So yes, you can go out, but it costs you more. But that's one of the disadvantages of the Advantage Plan. You have a limitation for providers. Now, if I get a supplemental plan over here, I can go to any doctor, any hospital, any provider that takes Medicare, and almost all of them do. All right, so that's an issue. Number two issue, which I think is critical, and that's this: about 72% of the services that you're going to need on your health insurance are going to have to be pre-approved, pre-authorized by the insurance company. That means that if the doc says we need a knee replacement, a hip replacement, MRI, CAT scan, skilled nursing stay, whatever, that's going to have to be approved by the insurance company, or you're not going to get that knee replacement, that MRI, that CAT scan. So what happens, doctor recommends it, but the insurance company must approve it before it's going to be covered. And sometimes they do immediately, but other times they delay the coverage or they deny the coverage. And you just have to live with that whenever you get an Advantage plan. If you have a supplemental plan, that is not going to happen. Why? Because Medicare and your doctor make all the decisions. The insurance company cannot interfere in any way. There's no pre-authorization with supplemental plans. And then thirdly, and I think this is critical, and that's this: permanent. And I alluded to this in the last slide, but I think it's real important to know that, remember, if you take that Advantage plan, one of the differences is Advantage plans are 1-year plans. It's an agreement between Medicare, insurance company, and you, and those come up for renewal every year. So sometimes you got to switch because the plans drop, they change their benefits, they increase them, reduce them. There's all kinds of activity, and so Advantage plans are just written for a year at a time. When it comes to a supplemental plan, it's a lifetime plan. That supplemental plan can never be canceled by the insurance company unless you don't pay the premium. And so that's a permanent plan. It's a plan that you can transfer. If you live in one state, move to another, you take it with you. In other words, they can never change it because of age, location, or claims at all. It is your permanent plan. And so also what happens when it comes to permanency, if I get on the Advantage plan and I'm on that for a year plus and my health changes, now what happens? Now I have to medically qualify to get off of it, so therefore I could be on that Advantage plan permanently, having to live with the pre-authorization, have to live with the networks, having to live with a copay plan and max out-of-pockets that reset every January, you see. And so the whole point is you want to make sure that you understand the differences because you have to live with the consequences of that decision. Of course, agents want you to buy Advantage plans. Why? Because we make more money, make higher commissions. But do you have better coverage? And are you comfortable with that? And if you're comfortable with that, then Advantage plan is fine insurance. But you have to live with these particular details here for the rest of your life on the Advantage plan.